Local authorities in England have a legal duty to shape local care markets, to provide a variety of quality care and support. Funded by the National Institute for Health Research, our research at the University of Birmingham identified different approaches to care markets and which work best. Comparing 8 local authorities, we found that market shaping varied in 2 ways. Firstly, how much local authorities try to control which services are provided, and secondly, by how close or distant their relationships are with service providers. The procurement approach combines tight control with distant relationships. Local authorities ask the market to supply specific services which can help reduce costs, but it limits scope for providers to innovate and offer choice. In the managed market approach, local authorities keep tight control through closer relationships with a smaller group of providers, for example through block or framework contracts. This approach is often used to stabilise the market, giving guaranteed hours to providers. However, we found that this reduced user choice and didn't lead to the expected stability due to shortages of care staff and funding. In the open market approach, local authorities have less control and distant relationships with the market, and people decide their own support needs, choosing from a wide range of providers. Whilst this offers scope for innovation, some people need help from local authorities with the risk and complexity of choosing their own care, which isn't always provided. Finally, in the partnership approach, local authorities share control and have close relationships with users and providers to co-design services. Popular with local authorities and providers, this is a long-term preventative approach and helps integration with other services. However, we found it could be difficult to achieve in practice, given funding constraints, high local authority staff turnover and care workforce shortages. The 4 approaches are often used in combination within a locality. For example, older people's services tend to be high control, with the low control approaches used more for supporting working age adults. The low control approaches are the most likely to support the personalisation and well-being aspirations of the Care Act. The open market, with lots of providers, maximises diversity and choice, whilst the partnership approach helps to secure long-term stability and an outcome focus. Open market and partnership approaches are both needed, but local authorities need to work differently to make them effective together. Open markets need facilitation to ensure a diverse range of services can be bought and users are supported in making choices. Partnership requires close relationships and trust between local authorities, providers and communities. As the approaches suit different types of provider, local authorities need to be clear about the reasons for their commissioning decisions to avoid confusion. Success relies on authorities building good relationships with providers, and so commissioners need the entrepreneurial and relational skills to do this. This is difficult without stable funding and policy from central government. Shaping care markets can't solely be the job of local government, but requires a sustained commitment by all stakeholders to deliver the Care Act's radical ambition of improving well-being. For more information about the research, go to our website or contact me, Catherine Needham, by email or on Twitter.